You are not too young for heart attacks. We are not too young to have a heart attack. Hey besties! We're back for another fun-filled, wonderful episode. And this month is Heart Health Month. So in honor of that, we're wearing our red, blinging it out, you know. And so we decided to dedicate this webisode to Go Red for Women.
Let's be honest. I mean, we're young, we're vibrant. We can't have heart disease, right?
No, of course not.
Right. False. Yes, we can.
Your heart pumps to all the organs. You need it for pretty much every part of your body. I mean, when you're in spin class, getting it in, or, you know, at the club, trying to get it in. Yeah, your heart needs to pump for that. Or when it melts, when you see the birth of your new child, or when you see the love of your life and your heart skips a beat, or when he makes you mad and your heart is on fire. So we have to have more appreciation for all the wonderful things that our heart does.
The biggest misconception that we hear out there is that women don't get heart disease, and they also don't get strokes or heart failure, but that's just not true. Cardiovascular disease is killing 1 in 3 women. So that's a woman a minute that dies from one of these diseases. It's just out of control, and we need to do our part to make sure to get that number down. Even in our 20s and 30s and 40s, we can still be affected by heart disease.
So this is for you, our young, fabulously fierce besties.
Stay tuned.
So heart attack, or as you commonly hear in the news, myocardial infarction, all it means is death of the heart muscle, and it's due to decreased blood supply to the heart. And so commonly when you think of heart attack, you think of it being caused by a big gumma or big plaque-filled thing full of cholesterol in a person that has high blood pressure and a person that has diabetes. And that is typically the people that have heart attacks. While heart attacks of this type can happen in our younger population, there are a couple other causes that I want you to be aware of. Vasospasms are pretty much when vessels within the heart start to spasm. And during those times where you have those severe spasms, you have decreased blood supply to the heart, and it can therefore cause heart attacks. Known triggers of spasms: hyperventilation, cocaine, or tobacco use. Another is if the blood vessels that supply the heart begin to tear apart, causing spontaneous coronary artery dissections. While those are very rare, they're much more common in otherwise healthy women. There's a thought that there may be a hormonal link, but it can be completely random. In short, don't take the symptoms lightly. Let the ER figure out what's going on with you. The difficult part is that women, and far less young women, present with more subtle signs for heart attack. So I think with our busy lives, it commonly gets missed, you know, or chalked up to being too busy or I'm too tired. So we don't recognize those signs and symptoms. Long gone are the days where you imagine the old man puffing his cigar, his cigarettes, drinking his alcohol, having high blood pressure and high cholesterol, grabbing his chest, falling to the floor, sweating, nauseated with the elephant sitting on his chest. Those days are gone. That's not what women present like typically. So we need to know what those subtle signs and symptoms are. It's not worth your life. So if you have these symptoms, call 911. Don't drive yourself to the ER. Stop whatever you're doing and get evaluated.